like every dog owner that gets that diagnosis, immediately started trying to learn everything I could about osteosarcoma when I found out he had it. I'm fortunate in that I know a lot of veterinarians in different specialties across the country because of my work as a canine trainer. So I talk to military vets, current and retired. I talk to my rehab vets that do all the, chiropractic and acupuncture just for maintenance work on the dogs. I talk to just about everybody that I trusted. And in the course of my research, I saw the Yale vaccine and started to read more about it. Went to your website, learned as much as I could there. You had done a podcast or a webinar with him, with Dr. Mamula. So I watched that. Then I reached out and saw if we could get Hunter on the vaccine. And luckily we could. I teach the search and rescue classes for Spike's Canine Fund. And I knew Jimmy was at Yale and had a lot of connections. And I said, would you mind reaching out to him? I was going to send an email, and I did, but I thought being able to explain, what Hunter's job was and things like that. And at that point, I was willing to call in whatever favors I needed to for Hunter's well-being. I realize I'm in a very fortunate position in that respect. Hunter had been involved. I brought him home at 8 weeks old. He was my 5th search and rescue partner, and I did all of his training. He had deployed. He was the first wave of FEMA disaster dogs in the country. For a while, he was one of a handful of dogs. His first FEMA deployment was the mudslides in Oso, Washington. He was not even 2 years old at that point. It was his first federal deployment. He helped me work a couple of FBI cases that we received an award from the director of the FBI. And so he's a really special dog to me and had served his country in a lot of ways. And there's always, since we don't know exactly all the factors and what contributes to osteosarcoma, I mean, he responded to coal power plants and every hurricane, it seems like, for the past decade. The Champlain Towers building collapse in Florida was his last federal deployment. So he had been exposed to a lot of environmental hazards. And it's always in the back of my mind, is that something that contributed to it? Did that cause it? He had actually been, one night I was walking in before a class and a car ran a stop sign and hit him on the left shoulder. I was able to jump out of the way. I just couldn't get him. We were in a well-lit crosswalk. We were halfway through and a guy ran the stop sign, clipped him. Luckily, there was no broken bones or anything like that, but there was tissue damage and things like that to the exact location where the cancer was. And at that point, I was willing to, like I said, call in any favors I had to be able to get him whatever kind of treatment he needed for the best chance at survival. And like anybody, I read all the statistics and was horrified at how short of a lifespan these dogs have after their initial diagnosis. I was fortunate because I had a lot of good guidance. I was fortunate because I spend every day of that dog's life with him in a working capacity and know his movement, any little thing. And the first sign was we had done 5 days in a row of disaster training, and he woke up that 6th morning and his gait just he wasn't limping, but it just wasn't even. And I was scheduled to take I had a puppy at the time that was going to be Hunter's disaster replacement. And I said, I'm not going to travel with Indy until I make sure that Hunter's okay. And I took him in, and most people would say, oh, he's overdone it. He's 9 years old. Here's some anti-inflammatories. Come see me in a while. And I went in and I said, I want you to x-ray every limb on this dog and his spine. And because they know me and because they understand that it wasn't a question at that point, they did it. And they were as shocked as I was that it was osteosarcoma. So it was very early compared to a lot of folks. It was within the bone. It had not ruptured through the walls of the bone. The walls of the bone was still very thick. When we went to do a bone biopsy, they actually had to try 6 different locations before they could even get the needle through the bone to take the biopsy. So she said, we just don't see dogs this early into the disease typically. And I know that was in his favor as well. There was no signs on ultrasound or x-ray that it had spread anywhere. So So after a lot of consultation, I went ahead and did the amputation. He did well. He did not like the medications. So once we got that straightened out and he wasn't so out of it, I guess, he was much happier. So it took about a week to adjust. That adjusted. I was fortunate I could work at home during that time and keep a close eye on him. By the time 2 weeks rolled around, he was really good. Aside from that, he was a very physically fit dog, great muscle tone, very thin golden retriever, because we keep all of our working dogs very fit and active. So he was trying to jump onto things very quickly. The biggest thing was keeping him quiet. I was fortunate to be able to start his first dose of vaccine after his amputation, before his chemo. His amputation was April 25th we were at 16 months, so it would have been 2022. He had a 16-month follow-up when I was back in Ohio a couple of weeks ago, and his x-rays look good. His blood work looks good. He is on a daily low dose of chemo, so he gets a pill every morning to maintain it. He also is seen by a veterinary specialist in rehab who does acupuncture and chiropractic, and he's on some Chinese herbs. He does the turkey tail. He also is on a supplement called Myos, which is a muscle builder. It's an egg-based protein muscle builder. So he's doing really well. He is on, I want to say chlorambucil, but I'm tired at the end of the day, a long day, so I'll have to look at his prescription when I get home and I can let you know. It's a very low dose that fortunate to be able to give him in pill form at home each morning. At the end of his injectable chemo, we did 6 rounds of it at Ohio State University post amputation, and he tolerated it well. The biggest problem we had with him was he had some loose stool, and they gave you all the traditional things that they give a dog. And I said, none of these are stopping it. I said, he's a dog who likes people, so you're assuming he's not stressed. And at the veterinary teaching hospital, as you well know, he spent all day there for a checkup, or all day there for a 20-minute chemo treatment. Finally, I was like, just bring him out to me. I'm not going anywhere. I'll be in the waiting room. Let him lay down next to me, because he's such a busy dog that he's not resting. So that contributed to it. And so after we established that, he was fine. I did occasionally give him some powdered pumpkin for the week post chemo to help with loose stool, because none of the other things, not the clay or the psyllium husk, none of that worked for him as far as helping. But we do powdered pumpkin. We've used it for the dogs because they get stressed on deployments. You can be gone for 3 weeks in really bad conditions on a FEMA deployment. So we always carry that in a powder form and be able to give the dogs that would exhibit some loose stool, and that seemed to resolve it. And that was really the only thing I noticed with him as a side effect from his injectable chemo. Even though he is a very fit and healthy retriever, he does not enjoy fasting. And had it been something that we couldn't control any other way, I absolutely would have done it, because he would have been fine. But knowing that we could control it, the only time he was fasted was from midnight the night before until the morning he received it. And usually, like I said, it was all day at OSU. We might get there at 7 a.m. for his blood draw, and then not be able to do the treatment until about 7 o'clock until about 4 o'clock that evening. So I took a job in the winter down in Florida. He's actually spending the summer with my mother in Ohio. She lived with me in Ohio. And so he and one of my other older dogs are spending the summer up there. It's a lot easier on them heat-wise and things like that. And I'm very busy in the office, and I wanted him to have the ability to run and play during the day. And I've got 5 acres in Ohio where I have a 1/4 of an acre here. So I knew he'd benefit from being up there. So he did go back for a 1-year checkup at the beginning of the summer at OSU, and then every 2 months right now is his schedule for x-rays and blood work. I'm going to bring him and the other older dog back here, and they'll be here until probably next summer. And so we're going to try to get him into MedVet in Cleveland in the next 2 weeks. So he responded with no side effects. He did get a little bit of the cyst. It did not become infected or inflamed. It was probably the size of a golf ball, but stayed under the skin at the injection site, and it was with the second booster. So overall, I feel like just all the things that I needed to have lined up for him from the the vaccine to being able, because at that time we were still on the back end of COVID. And I know people were waiting an incredibly long time just to be seen by an oncologist. And I happen to have a friend who's an oncologist at OSU, and she said she managed his surgical care. So that's the side that she's on. They got him in. From the time I noticed the limp to the time that we amputated was 10 days. I was very, very fortunate to have a lot of folks help me on this journey. I follow the Facebook pages for the osteo and the hemangio and all of those things. Since my very first search and rescue dog did have hemangio, he had it in his skin is where it first presented. It was, they told me, very rare. I noticed what looked like a blood blister on his skin, and we tried everything we could. This was 20 years ago, so it was really early on in any of this kind of research, and he made it 9 months. And I didn't have insurance, but I spent, as a 20-something person, I spent everything I could to try to save him. I was going to pursue whatever I needed to do, and that was the deal that I made with my dogs. I asked you to do very hard things for jobs that you didn't choose to do. I chose those jobs for you, so I will make sure that you have the best quality of life I can give you. And so from that dog on, all of my dogs have been insured. So while it doesn't solve everything, I make sure that that's never a consideration when their health comes into play, because we know they're going to come into something. It's like a human athlete. At some point, they're going to have either an orthopedic issue or, God forbid, cancer or some other thing. And I don't want the money to decide whether or not I can give them the best chance at a good life. And because Hunter, being a golden at soon to be 11, it's expensive, but I don't regret it at all, because I'm not the kind of person that can set aside, X amount of I just want to pay that insurance bill and be done with it, and not think, oh, but I need to buy this or I need to buy that. The insurance gets paid once a year and it's just done, and it's not thought about again. And since I started them as puppies, it does make it an easier thing, because they get in at a much lower rate when they're puppies. And the two younger dogs I have now, they're on a group plan, a search and rescue group. So it's very manageable for me to be able to do that. I've had good luck. I know not everybody has, but alternative treatments, rehab, they've never questioned anything that I've submitted. We have, I'm part of a group through Trupanion, and it's a large group of search and rescue dog handlers, and that person manages it for the group. So every year we figure out we get a notice about what our premium is going to be for the year, and they work with us, and you can choose your deductible range and things like that. And I think there's around 50 of us in that group policy right now. So the plan for that, they knew they wanted to include rehab modalities and things like chiropractic and acupuncture and things like that. So as a group, that was decided, and that's what I have for Hunter. Hunter is not on that plan because he had pre-existing conditions from some allergies and things when that became an option. And I just wasn't going to take the time to switch him over, because I was having, even though Fetch was getting more expensive, all of his stuff had been through them. And so nothing would be pre-existing with them as long as I stayed with Fetch for him. I hope that it becomes just standard of care, and everybody that needs it is able to access it. And, I hope that I have him for many more years, but at 16 months of healthy post-amp and everything, I feel grateful. I feel very grateful to have 16 healthy months. So I'm just not taking anything from here for granted, and just enjoying him.